If your kid ends up in the hospital, the person most likely to catch a problem before it becomes an emergency isn't the doctor, it is the person you barely remember the name of. The one who was in the room for hours while the doctor was in for minutes. Stick with me. This one's going to change how you see every hospital visit from now on. Now hold on, before you think I am about to trash doctors. I am not. Doctors are essential, they diagnose. They make the big calls, they carry enormous responsibility. But there is a massive misunderstanding about who is actually watching your child hour by hour. And that misunderstanding can genuinely affect how you show up as a parent in that building. Let that sink in for a second. Here is how it usually goes. A toddler gets admitted for a bad respiratory infection. Parents are terrified, exhausted, running on fumes. The doctor comes in once in the morning, explains the plan, answers questions, leaves for the rest of the day and night. It is a completely different person in that room. Checking oxygen levels every hour. Adjusting the 4. Noticing the toddler's breathing pattern shift slightly at 2 a.m. A change so subtle the parents didn't even register it. That person makes a call. Gets the doctor back in the room within minutes. What could have quietly gotten worse overnight, gets caught and treated immediately. The parents thank the doctor the next morning. Understandably, that is who they associate with being saved. But the doctor wasn't even in the building at 2 a.m. That is not a knock on the doctor. That is just how the system works, and most parents don't realize it until they've lived it. Here is the truth. A pediatric nurse is not the doctor's assistant. That description undersells the job so badly, it is almost inaccurate. A pediatric nurse is a licensed medical professional trained specifically in the physiology, medication dosing, and emotional needs of children, who spends more continuous hours with a hospitalized child than any other member of the care team, including the doctor. They're the ones tracking vital signs constantly. Administering medication precisely, because pediatric dosing is calculated differently than adult dosing, and mistakes there are genuinely dangerous. Watching for the small behavioral changes that often show up before a test result does. Nobody sits parents down at check-in and explains this. There is no orientation packet that says, by the way, this is the person who will actually notice if something's wrong first. Most parents figure this out only after a long hospital stay, or worse, only after something almost went wrong. So why does this misunderstanding persist? Reason 1: hierarchy bias. Culturally, we're trained to see the doctor as the one in charge, which is true for diagnosis and treatment decisions. But in charge of decisions and the one physically present most of the time are two completely different things. Reason 2: doctors deliver the big moments. The diagnosis, the prognosis, the plan. Those conversations are memorable and emotionally loaded, so they stick in a parent's memory far more than the quiet constant work happening in between. Reason 3: nurses are, frankly, underrepresented in how healthcare gets portrayed. Medical dramas center doctors, public health messaging centers doctors. The actual day-to-day backbone of pediatric care doesn't get the same spotlight, even though it is doing an enormous share of the actual work. None of this is anyone's fault individually, but it means most parents walk into a hospital without understanding who they should actually be building a relationship with. I know some of you are thinking, okay, so what do I actually do with this information? Good question. Let's make it practical. Here is exactly how to use this understanding to actually help your child. First, learn your nurse's name every shift. Not as a formality, because a nurse who feels like a known, respected partner in your child's care communicates more, and communicates faster, than one who feels like invisible staff. Second, report changes to the nurse first, not just the doctor. If your child seems off in a way you can't quite explain, tell the nurse immediately. They're trained to take parental observations seriously, and they have the authority to escalate to the doctor immediately if needed. You don't need to wait for rounds. Third, ask questions about medication and monitoring directly to your nurse. They often have more real-time detail than the doctor does, simply because they're the one physically administering and observing. Fourth, understand nurse-to-patient ratios if your child is in a serious situation. In pediatric intensive care, ratios are typically much lower than on a general floor, meaning more direct attention per child. If you are ever concerned about the level of monitoring your child is getting, it is completely appropriate to ask the charge nurse about staffing and how closely your child is being watched. Write this down: respecting and directly engaging with your child's nurse isn't a nice to have. It is one of the most practical things you can do to actually improve your child's care in real time. But here is the part that is a little uncomfortable to admit. Even parents who read something like this, who nod along and think, yay, that makes sense, still default back to only asking for the doctor the second something feels wrong. Old habits are strong. Stay with me, because what I am about to say next is about breaking that habit before you are standing in a hospital room needing to. Let's be honest with each other. This video isn't going to instantly rewire how you think about hospitals. Cultural habits don't work that fast. Some of you are going to walk into an appointment next month and still direct every single question to the doctor, out of pure reflex. Even after watching this, I am not going to pretend that is some kind of failure. It is just how deeply this hierarchy is baked into how we think about medicine. But here is what doesn't change no matter how strong the habit is. The nurse is still the one with the most hours, the most direct observation, and often the fastest ability to act. Ignoring that reality doesn't make it less true. It just means you are not using the full resource available to your child. This isn't about guilt. It is about noticing the habit next time, and redirecting one question to the right person. Now here is the part that actually matters. Understanding this role doesn't require you to trust doctors less. It requires you to trust the entire team more accurately, to actually see the full picture of who is protecting your child, instead of only seeing one piece of it. You don't need to become a healthcare expert. You don't need to memorize protocols. You just need to know that the person checking on your child at 2 a.m., the one adjusting the one who notices the small things, that person is not a background character in your child's care. They're one of the most important people in the room. The parents who navigate hospital stays best aren't the ones with medical degrees. They're the ones who built a real relationship with everyone actually in the room, not just the one with the title. You just became one of those parents. If this video changed how you'll walk into your next hospital visit, that was exactly the point. Next time you are there, learn your nurse's name. Ask questions directly. Build that relationship. It genuinely matters. If you want more videos like this, ones that show you what is actually happening behind the scenes in your child's care, hit subscribe. This channel exists to close exactly this kind of gap. Let me know in the comments. Did you already understand what a pediatric nurse's role really looks like, or did this catch you off guard? I read every comment, and it genuinely shapes what I cover next. One important thing before you go: I am not a nurse or a doctor, and this video is for education, not medical advice. For anything specific to your child's care, talk directly to your child's care team. See you in the next video.